How behavioral health returns can be improved with technology. Top ways to boost behavioral health practice revenue with tech and management. Behavioral health has for some time now lingered in some challenges, cutting across the health sector, individuals, and practitioners. In 2020, the Census Bureau reported that about a third of Americans showed clinical anxiety after the COVID-19 pandemic. What are the benefits of behavioral health? Physical and mental wellnesses are focal while discussing behavioral health. Its importance makes of good essence the interdependence of physical, emotional, and mental as it regards an individual. Challenges of behavioral health practice. Clinical practices are not without their holds of difficulty. Even with the advent of technology, they serve as the central hook for other forms of innovation in the sector. Health systems, especially behavioral health care, are confronted with a couple of highlighted and discussed below. Number 1, costly and inaccessible healthcare systems. The percentage of the world population that can afford a care system on its A game is minute. While quality health cannot be limited to a particular caste, it's still a serious issue to consider because of their riches. In situations whereby a specific mental health crisis is tied to a physical health issue, the poor man might sadly have to pay the heavy price of his life. And regarding this, most people would shrug off their unwellness with the hope of getting better because they can't afford the cost of their treatments. Number 2, health drivers and stigmatization. In fact, in most places around the globe today, this reason is why people don't come out to address their issues. And contrastingly, this isn't usually the case with physical health challenges. Most people, especially teenagers and young adults, would prioritize reputations over their health because they don't want to be seen as their problems. Moreover, specific health drivers, like quality food, income, and quality living, have significant outcomes on behavioral care. Number 3, breach in scientific and clinical knowledge. Most behavioral abnormalities are initially misdiagnosed. This is because scientific research about behavioral disorders is still developing. These disorders have various links of causes, symptoms, diagnoses, and prognosis. Right now, outright classification of causalities hasn't yet been achieved. Hence, most cases encountered now are being treated, with several recommendations being made based on a trial and error basis. Unfortunately, the downside to these adverse health effects and sometimes death. Number 4, non-uniform operations of healthcare data. Data sharing imperfection across healthcare data providers is another challenge. This doesn't necessarily translate to interoperability among clinicians and other practitioners where data are transmitted. Remedies to these challenges. 1. More attention should be paid to science and technology. Considering the early stages of behavioral care science is on, it's believed more outstanding discoveries would be unveiled. 2. Easy data sharing and interoperability. Physiological and social data sharing would be a huge benefit to making findings. Electronic health records, EHR, are an effective way to access these data. 3. With the changes achieved, quality health would be dispensed to the people. How would the revenue boost happen? Technology and management in behavioral care have peculiar benefits to players in healthcare provision. The revenue boost will happen as follows. 1. Government policymakers are potent players in the behavioral health landscape. Working with other health sector players, they should ensure healthcare coverage. 2. Public and private sector insurers should focus on plans to support quality care. This includes ensuring proper collection of data and their analysis. 3. Care providers should harness new technologies to deliver better outcomes. 4. The use of electronic health records, EHR, helps save money spent on paper. 5. More accessible healthcare gives room for more consumer insurers. Conclusion. The behavioral health system is set to be transformed by technology. Hence, the only way to boost the sector's returns is to prioritize technology. The rate of change with science and technology now sets a projection for future dependence.